Governments around the world may have wasted billions of dollars stockpiling a flu drug that doesn't work. A study published in the British medical journal found no evidence that the drug Tamiflu lowers the risk of complications. Dr. Fiona Godlee, editor-in-chief of the BMJ, says this case shows that the entire system of evaluating drugs needs radical reform.
The research shows two main things. One is that the drug seems to be less effective, or we have evidence that it is less effective than was previously thought, and that it doesn't seem to be clearly effective in reducing complications in healthy adults. But it also shows that the data available for evaluating drugs generally is inadequate, because drug companies hold on to data which should be more publicly available. So I think we do need to have a radical rethink of the way in which drugs are evaluated and the data are made available. The fact that this particular case has required detective work by journalists and academics with limited resources suggests that the current system really isn't working.
And we are joined live by Aleksey Yaroshevsky from Ukraine's capital, Kiev, where Tamiflu has already been at the center of a scandal. Hello to you, Aleksey. Is Tamiflu widely used in Ukraine?
You see, Rory, when the epidemic broke out in Ukraine, there was so much panic in the streets of the Ukrainian cities that people were so much scared of the alarming rate of the death toll. They were sweeping the anti-flu medication off the shelves of drugstores. And in just several days, no one could find just simple anti-flu medication in local drugstores. Just a few days later, the Ukrainian government called for international help, and soon a shipment of more than 15 tons of the Tamiflu drug was delivered to the country. However, by this moment, it was already in the epicenter of a scandal. Prime Minister Tymoshenko spoke of private drugstore owners who sold the drug, the Tamiflu drug, at 10 times the price, 10 times the original price. And she called on strict legal action against the private drugstore owners who sold this medication. However, we understand that it was widely explained in Ukraine that the Tamiflu does not work as a preventive medicine. It only is good for those who are already infected with the H1N1 virus. So it hasn't been distributed in drugstores around the country. It went directly to hospitals to treat those already infected, already diagnosed with swine flu and other respiratory diseases. And I understand, having my ear on the ground here, that I haven't heard anybody speaking of using the Tamiflu drug. People in Ukraine prefer more traditional ways to fight the virus, such as ordinary medicine, ordinary medication against the flu, and also the traditional methods such as garlic and onions. So I haven't heard anybody talking of using the Tamiflu drug here in Ukraine on a regular basis.
Aleksey, certainly over the past couple of months into this winter already, in Ukraine, the level of the flu spreading has been devastating, to say the least. What is the level of the flu epidemic now?
Indeed, Ukraine has been one of the most struck countries by the H1N1 virus. The latest figure we've heard, the death toll was 474 people dead due to different respiratory diseases and the H1N1 virus. For the time being, we understand that the swine flu epidemic is not making headlines in Ukraine any longer, and quarantine, which had been in place for more than 3 weeks, has been lifted. But we heard indication from the World Health Organization which said that the country is facing a second wave of the virus outbreak, and it could be even more serious than the first one. Given the latest speculation concerning the effectiveness of the Tamiflu drug, it is unclear where will the Ukrainian government be seeking help should another wave of the epidemic arise in Ukraine. For the time being, it's pretty much unclear what will happen next.
Aleksey Yaroshevsky reporting live from Ukraine. Thank you very much for that. And according to freelance journalist William Engdahl, the World Health Organization has created an environment of panic that's meant that people are now taking some dangerous treatments that they don't actually need.
I must say that the alarm that the WHO is sounding over H1N1 is really leading people to do very, very dangerous things, such as taking antiviral drugs that have symptoms which can cause death in the cases of Tamiflu and so forth, and especially in young children. I think they're trying to unnecessarily feed a sense of panic in the population, that people demand Tamiflu from their doctors and demand all sorts of harmful medications. Pharmaceutical industry has been having a field day of profits after this swine flu scare.